Hello and welcome everyone. This is Dr. George Gonzalez with the Hologram Podcast. And a huge request has been from a lot of the doctors that I train to go over the light therapy. And I often refer to two articles or manuscripts of collections of research done on light therapy. And I'm going to review the first one on this video, and I'll make a second video on the other manuscript. So I want you to ideally print this out. If you're a health professional, you should print this out, get a highlighter, and just highlight the main points that we're talking about. And then you could either use this, of course, for your reference, but you could leave this in your waiting room if patients have questions about light therapy, therapeutic use of light therapy. The article titled is Role of Low-Level Therapy in Neurorehabilitation. So I have this on the computer. I'm going to share my screen, and let's all get on the same page here. So here it is. This is from the National Institute of Health. This is a author manuscript, and the title is Role of Low-Level Therapy Rehab. These doctors, the authors of the document, thank you very much to those doctors for putting the work in so all of us could benefit from this collection of information. So this is the doctors, what they did is they looked through as much of the research in the area of neurorehabilitation as possible for the use of therapeutic light therapy. And then they came up with a summary of all these different things that light therapy has shown to be beneficial for. So let's walk through this here. And see, this review will cover the mechanisms of LLLT, which is low-level light therapy, that operate both on a cellular and a tissue level. And so mostly what you're going to recognize is that light therapy affects light sensitive aspects of cells, and the mitochondria being the primary organelle within the cell that is very sensitive to light therapy in very specific frequencies, mostly the red and infrared. And here the mitochondria are thought to be the principal photoreceptors and increase in ATP, reactive oxygen species, that's ROS, intercellular calcium, the release of nitric oxide, and the initial events, activation of the transcription factors that lead to expression of many protective anti-apoptic or cell death, and antioxidant and pro-proliferation gene products. So in other words, these are all beneficial things for the cells that are noticed to be stimulated in general across the board when we're talking about light therapy for neurorehabilitative purposes. So whether it's red or infrared, and they're going to talk about the levels of strength that they're talking about. So in this animal and human research studies, LLLT as indication with relevance to neurology, such as stroke, traumatic brain injury, degenerative diseases, spinal cord injury, and peripheral nerve regeneration. So stuff going on with light therapy. When I started, we didn't have this much information, which is absolutely amazing, especially all summarized for everybody. Now, here I'm just hitting the highlights of the article. Please read it at length on your own. But many of the important, compelling applications of LLT, low-level light therapy, are in the field of neurology, and both central and peripheral. Many serious brain diseases and injuries can be successfully treated with non-invasive transcranial, that's across the skull or through the skull. Furthermore, in peripheral nervous system, low-level light therapy can be used effectively for nerve regeneration. That regeneration means what it says. It's regenerating the nerve tissue, and pain relief, okay? Now, all these things I'm highlighting are really important concepts, and this whole section here is important. but let's go before us. There we go. Yeah, we'll deal with that. So low-level light therapy is used forward laser light at the range of 1 to 1000 milliwatts. Now, milliwatts refers to the power of the light therapy. It refers to, consider that the volume knob. So if I have a red light, light therapy device, laser or LED, and it's at 100 milliwatts, that's the volume. Okay, and I could turn that volume up on that red laser, and at 100 milliwatts, it doesn't increase the temperature of the tissue, it doesn't burn, it doesn't do anything of that nature until it passes 1000 milliwatts. Then you start seeing the heating of the tissue and cellular destruction potentially if you turn it up high enough. And that's, I call that the volume. In the technical term in laser light therapy is power or output, power output. So that's measured in watts or milliwatts. We're working in the milliwatts. The light therapy products that I recommend are in the 27 milliwatt range. So it's very small stimulus, even compared to what they're talking about here as the full range of the low-level light therapy spectrum. So at wavelengths from 632 to 1064, which is red and near infrared, to stimulate the biological response, these lasers emit no heat, no sound, or vibration. Instead of generating a thermal effect, low-level light therapy acts by inducing photochemical reactions in the cell, a process referred to as biostimulation or photobiomodulation. You'll also hear biomodulation and a few words similar to that of what I just said here. Photobiology works on the principle that when light hits certain molecules called chromophores, the photons cause the electrons to be excited, and they jump from low energy orbits to higher energy orbits. So I don't want to get into the details of the biochemistry actions. I just want to hit the highlights of this article here. And so what we want to recognize is that the cells perform specific tasks. So here's cellular tasks that are formed, and the cellular tasks include photosynthesis and photomorphogenesis. And examples of this photosynthesis would be in chlorophyll in plants, which is green, bacterial fill in blue-green algae, which is blue. We have flavoproteins, which are yellow, and heme or hemoglobin found in red blood cells. So these colors are respective of the body's wavelengths has within itself. And if you watch the interview I did with Dr. Chris Astle-Smith, I've interviewed him twice. He talks about the light receptor cells that are affected by light, the cell receptors that are affected by light. And he lists them all out, and these all have potentiality of being stimulated with light therapy to show benefit, therapeutic benefit. Let's see, when we're talking about light therapy, we're mostly going to be looking at the concept of mitochondria. Mitochondria, as I mentioned, it's highly stimulated by light therapy, especially in these intensities, low-level light therapy intensities with red and near infrared that I've been talking about. So let's see, right in here, we'll go to the end. Oops. There you go. Okay, laser irradiation caused an increase in mitochondrial products such as ATP, protein, ribonucleic acid, which is RNA, a reciprocal augmentation in oxygen consumption. A similar effect is produced when mitochondria is exposed to low-level radiation. Visible and near-infrared light is absorbed by the organelle, and an upregulation of cellular respiration is observed. That's a big deal. And so we can see here that it was observed that low-level light therapy mechanisms of action affect the mitochondria. So if you're familiar with chemistry, you're going to see certain aspects of biochemistry that transport electrons to create ATP energy. And one of these is in complex 4, also known as CCO, okay, which is one of the large transport membranes within the mitochondria. So CCO, it absorbs light in the red and near infrared ranges, and that's where the actions are occurring. So you could check that out. And again, the important thing to recognize that these things are stimulating most of healing that comes from light therapy is attributed to an improved energy creation within the cell, or what they call biomodulation. Is if the cell is damaged, it brings it up to functioning levels, and that allows for the healing to happen. Because whether you get physically damaged, whether your tissue is affected by a disease, an injury, infection, or condition, cells get damaged and their mitochondrial production is damaged as well. And so when we use light therapy, we're stimulating these factors that bring health back to the cell. Now, it's not in this article, but the concept is the true in the opposite direction. If you have a proliferative tissue, such as cancers and those types of things that create lots of cells, what they find is when you use light therapy, it biomodulates, it brings that function down to the normal level as it brings the damaged tissue up to normal level, which is a fascinating result of using light therapy. So another thing that they talk about here is the disassociation of nitrous oxide from the CCO transport mechanism. So let's see, uh, by dissociating the the NO, nitrous oxide, from the CCO transport, the low-level light therapy prevents displacement of oxygen from CCO and therefore promotes unhindered cellular respiration. So think of this as perpetual motion on a cellular level. Nitrous oxide mixes in the CCO somehow, and it limits its ability to continue. I think of it as, you know, when you're running and you're exercising and you get that buildup of lactic acid, the soreness in your muscles that prevents you from running forever, right? So similar concept on a cellular level, we're seeing that nitrous oxide is affecting the CCO membrane so that it's not able to continue in its cellular respiration. And it talks about unhindered cellular respiration, which is a big deal. It means that it could keep on going. It's not going to get there, even though the workload is heavy, especially in damaged tissue and healing tissue. So it's a big idea. It's really, really important. So again, you could read the detail of this. I don't want to get too into the biochemistry, but I just want to hit the highlights of what's important in this article here. Now, we talk about oxygen. The light therapy classically stimulates oxygen production in the cell. And so what happens is the oxygen is metabolized. Oops. It's metabolized and then produces reactive oxygen species, ROS. And it's a natural antioxidant that produces superoxide dismutase, SOD, and hydrogen peroxide. Both these are very good at removing the toxins, the free radicals from your body, and they're very important for your body's speed and healing. So let's see here. We have a little bit here. So because low-level light therapy promotes the metabolism of oxygen, it also acts as an increase in the reactive oxygen species production. Okay, let me go to the next page here. I should continue my conversation. It increased ROS, which leads to this whole section here, which leads to the upregulation of various stimulatory and protective. The ultimate effect of low-level light therapy is likely to be produced by transcription factor activation, which modulates a host of downstream cellular tissue responses. In other words, it builds up whatever it is that's necessary to do all the chemical processes down the line. And that's a real important concept that's important for our healing. So let's see, other mechanisms of low-level light therapy that are mentioned here. We mentioned already that the nitrous oxide is a vasodilator also. So it makes it more efficient because it's not being mixed with the CCO. So now you have more nitrous oxide to help with vasodilation, and that's important for increased circulation. I think they give it's nitroglycerin they give to people with heart issues so they could open up their blood vessels and increase their circulation. Nitric oxide is also created in the cranium, and through proper respiration you increase your nitrous oxide levels. So all very important things. So now let's go to here. We talked about the of nitrous oxide from the CCO. And now let's talk about this section here. Oops. Okay, low-level light therapy promotes the synthesis of deoxyribonucleic acid, DNA, and RNA, ribonucleic acid, and increases the production of proteins. It also modulates enzymatic enzymatic effects activity and affects intracellular and extracellular pH. It accelerates cell metabolism, the expression of multiple genes related to cellular proliferation, the migration and the production of cytokines and growth factors also have been shown to be stimulated by low-level light. So all these are very powerful things that we see as an effect of light therapy. It's really important to understand these are just generalities of light therapy in this sub 1 watt range. So 1 milliwatt to 1,000 milliwatts. When you get to 1,000 milliwatts, that's the same as 1 watt. And then you start increasing tissue temperature, and then it's 1 watt, 2 watt, 3 watts and up. Okay. So this is a big deal. And then as it says here, light is a powerful force that has a lot of different effects on the nervous system. And in spite of knowing the effects through all these studies that have done, they really still don't understand the fullness of why light therapy does what it does. Okay. So now we're going to talk about stroke. We haven't even talked about a condition yet. We just talked about the generalities of light therapy on the cellular level. So most of the things that we talk about are going to talk about the reason it works is because increase cyclic AMP and increase oxygenation and those things. I'm not going to get into the details of all the research. I just want to show you that it's here so that you could find it for yourself and know what kind of things are happening with light therapy. First of all this is done with transcranial low-level light therapy that we're talking about here. And they're talking about a stroke, and has significantly improved recovery after ischemic stroke. Ischemic is lack of oxygen in rats when they received 1 treatment. Significant recovery and significantly improved recovery after 1 treatment 24 hours after sustaining their stroke. Now, I can't tell you what to do, but I know if, God forbid, if I ever had a stroke, I know what kind of therapy I'm going to be searching out. Especially within the 24 hours, right? Because this is a big deal when we start talking about the ease of application. we start talking about the ease of stimulation. Later on, they talk about the cost of the therapy. All these things are viable, useful ways of helping people when they're dealing in this example, we're talking about stroke. Now let's continue on here. And so what they're doing is they're using the light therapy transcranially to illuminate the contralateral hemisphere, contralateral to the stroke, and that's to stimulate the function. And oops, I didn't want to highlight that much there. Sorry about that. Okay, so they applied the laser transcranially through the skull to illuminate the hemispheres on the opposite side of the stroke. And the brain tissue in both models of stroke, the neurologic deficits at 3 weeks after the stroke were significantly reduced. And so that's a very big deal when we start talking about these effects, because you have to remember they're doing this with a control group as well. So they're measuring the effects of the damage of one, in these cases, rats, compared to the rats that were not treated. Also, we have transcranial stimulation. Oops, towards the here. May prevent apoptope. Transcranial low-level light therapy. This is right now, there it goes. May prevent improve outcomes by exerting the neuroprotective effect. That's a real important concept, the neuroprotection. By building up the energy within the neuronal tissue, what we see with light therapy is this neuroprotective effect that even after somebody has received light therapy, if they're damaged afterwards, what we've seen through just experience through treating people is they have a more resilient nervous system to being damaged after they've been rehabilitated with light therapy, in my opinion. And I feel that they're referring to that here because of the neuroprotective effect that it has on the nerves. So we also, they did the rabbit studies that the transcranial LLT improves functional outcome after stroke. Kind of lost myself here. Here it is. So there we go. And a recent rabbit study combined, oops, I'm sorry, I skipped a section here. In the aforementioned studies, it has long been observed and hypothesized that increased mitochondrial function, the increase in APT production, is why when the cells are irradiated with LLT, that they see this as the major mechanism behind the function. And just to notice here, they noticed a huge benefit in the behavioral effects of the animals after using light therapy. So if you have an ornery little bunny, you could light them up and they're going to behave better. But just as when we talk about this therapeutically, we clinically stimulate several nerves, including the cranial nerves. And once you calm those nerves down, neurologically speaking, we see a calmer person afterwards. It's harder to rile them up. But when you have an irritated nervous system, it's very easy to be upset because it takes, they have a short fuse, so to say, when you're talking, you know, colloquially concept. So now the other found it important enough to share a quote here, but I'm skipping something. So let me go back. I'm checking against my notes here. Something that's important for all those people that train with me. The authors observed, this is an important concept. The authors observed that PW pulsed wave modes, 100 hertz and 1000 hertz, were more effective than CW, continuous wave modes, to increase cortical ATP. They hypothesized that in the future, stroke studies in animals and in humans rating scores might be achieved by optimizing the method of near-infrared transcranial light therapy delivery, including the length of treatment and the mode of treatment, to pulsed wave. So anybody who's trained with me knows that we use pulsed frequencies, and I feel that that prevents the adaptation of the nerve. So when we stimulate the tissue in a pulsed fashion, it doesn't adapt to the light therapy. And when we're looking at that, this research agrees with that. But I feel that the body adapts to light. Just like we walk into a room with light, we quickly forget that it's on our body. Or same if we put on a wristwatch or some jewelry, my glasses. Very shortly, you forget that you're wearing these things because your body adapts to that signal. But when we pulse that signal, it's harder for the nervous system to ignore it. And so, in my opinion, that's why we see improved stimulation for certain aspects of healing with pulsed wave light therapy. And in my opinion, with neurological rehabilitation, pulsed wave is superior to continuous wave. But I have seen research studies that suggest that continuous wave is better for wound healing. So different application, and that's fine, but it's just nice to know the difference for what we're doing. Okay, so now we have therapy shown significantly improve the outcome of acute human stroke patients when applied approximately 18 hours after the stroke occurred, the entire surface of the head. And we've seen this clinically. We've seen the results of patients' improvement when they use light therapy. And even if they didn't use light therapy, when they begin to use light therapy, we see improved outcomes with patients. Again, this is the therapeutic application of light therapy. You have to really understand how to do that, and we teach people how to do that. But this is talking about the general application of light therapy in the field of light therapy here. So the authors of this article, they wanted to quote here to mention from Lampel, and it goes down to the next page here. So they wrote, although the mechanisms of action of infrared therapy for stroke is not completely understood, infrared laser therapy is a physical process that can produce changes at the tissue level. The putative mechanism involved stimulation of ATP formation by mitochondria, and may also involve prevention of apoptosis, which is cell death, in the ischemic penumbra, and enhancement of neuro recovery mechanisms. So just in general, it seems like this doctor is suggesting that, all the light therapy that's being used, all the concepts of infrared and light therapy are showing beneficial neuro recovery mechanisms, which is great. So let me go to my next page here. Now, Dr. Nasser, who is one of the people who wrote this article, is an acupuncturist, and so she, I'm sorry, I'm assumed as she, I'm not positive about it. Dr. Nasser, the study of application of low-level laser therapy and laser acupuncture instead of needles to stimulate acupuncture points on the body of patients with paralysis. So it's important to understand that when we're using light therapy at this range, we're affecting the meridian system of the body. And that's a real important factor. And I'm not going to go through all the details of her research. I'm just going to hit some highlights that I think they're important to hit. So let's see. Something important to recognize when we're talking about brain injury, and they documented here, they said clearly beyond the spontaneous recovery phase, which is considered to be the first 6 months of the stroke. So in rehabilitation, they consider the spot of rehabilitation to be 6 months after the initiation of the problem. Now, many doctors will say there's no recovery that happens 6 months after those injuries show up, neurologically speaking, but they don't know what we know in terms of rehabilitation. They may not know what we know even with just basic light therapy stimulation for these concepts. So just know that through our clinical experience, we've seen significant rehabilitation potential well after this recovery phase, this recovery phase that's talked about in all neurological rehabilitation circles. So please don't let that disappoint you, because we've seen people get benefits regardless. Now, important here is low-level light therapy. Overall, the patients that work with acupuncture, 5 out of 7 patients showed improvement. Okay, so going to the next page here. Now, Dr. Nasser goes on to mention that these findings are intriguing and suggest that some recovery of motor function can occur with needle acupuncture or with low-level light therapy acupuncture applied to the body, acupuncture in chronic stroke patients. Now, they also talk about the combination of therapies. So using a combination of laser therapy with TENS machine. And I'm not going to go into the details of that. It's you know, if you use those type of therapies, you can get into the more details, an idea of the possibilities of what people are doing to help benefit their patients. Now, we traumatic brain injury, and this is a main event. When we talk about neurological rehabilitation, the stats here are pretty staggering. So we have each year in the United States, more than 1.4 million new cases of traumatic brain injury occur, and more than 80,000 persons are left with permanent disability. That's staggering. That's staggering. So, you know, when we look at that, it mentions here that head injury from military personnel, very common to see that. And they say that it ranges from observable to microscopic effects. So they talk about the use of transcranial low-level light therapy to, they started doing this in mice. And important to recognize that they did the therapy, I think it was 1 session, and after 28 days, they recognized that the brain tissue volume of the mean lesion size of the injury area was significantly smaller than in the control group after 28 days. Now, let's see, the researchers suggested, you'll notice that the authors are within this article going like, why isn't it doing these things? And you see that here. And it said the research suggested various possible mechanisms, including an increased ATP, total antioxidants, that's the ROS, the increased superoxide dismutase and hydrogen peroxide, the angiogenesis, neurogenesis, so angio is blood vessel creation, neurogenesis is nerve creation, heat shock proteins content, and anti-apoptotic effect, similar to observations reported after low-level light therapy treatment of ischemic heart skeletal muscles. So somewhere in their research, they have the references there talking about they see the similar effect on heart tissue after an ischemic event, a low oxygen event in the heart, as well as in the brain. So very promising. That's why I love light therapy. Light therapy is, in my opinion, the absolute best therapy there is. And anybody who's trained with me knows that. but it's nice to see the research behind. Now, the study concluded laser phototherapy could positively affect the balance of these factors in rats and thereby prevent cell death after traumatic brain injury. So what happens after traumatic brain injury oftentimes is the tissue swells up. The brain doesn't really have many ways to manage traumatic brain injury other than swelling. And then in that swelling, the constriction within the skull often causes this apoptotic event. The cells just start dying off, and then that causes even more problems. But they're talking about in the different layers of this document, talking about the neuroprotective elements that we see, and part of this, in my opinion, is what we're seeing here, is that preventing of cell death in traumatic brain injury is because the resilience on a cellular level is improved. So let's continue here. Now let's talk about some human studies. These authors did 2 human studies, and the transcranial and near infrared LEDs, and they go into the details of all they did. The first of the studies was done on a 66-year-old woman here, and she began transcranial LED treatments 7 years after her auto accident, and after 8 weekly LED treatments, her focus on computer time increased from 20 minutes to 3 hours. Okay, so that's significant. After 8 weeks of nightly home therapy, she improved from 20 minutes to 3 hours. I don't know the numbers on that, but it's significant. And then she continued to treat herself at home for 5.5 years after this, and she maintains her improved cognition, and she's now 72 years old. So case number 2, it involved a high-ranking female military officer, and she had a history of multiple traumatic brain injuries. Now, her MRI showed frontal parietal atrophy, so atrophy of the front and the top of the head. The front is part of the head that's deals with emotion and those kind of things. And then we have the parietals, which is our sensory cortex area. So a lot of important areas that were atrophying on this woman. And notice that she was disabled for 5 months before they began the nightly transcranial LED treatments at home. And after 4 months, this is pretty staggering. After 4 months of nightly LED treatments, she returned to work full-time as an executive consultant for international technology consulting firm and discontinued medical disability. That's a big deal. That's how many times we hear people discontinuing their medical disability. One is you have to have the right patient, right? They have to be motivated to want to live a healthy life and be active and those kind of things. But to have somebody come off a disability and get back to working full time, it's always exciting to see that. Now, it continues on with some details here that I think that are honorable mentions. That so the patients reported a decrease in her post-traumatic stress disorder after a few months of using the transcranial LEDs. What I talked about, the ability to handle stress. The nerves are specific, in my opinion, the cranial nerves, when they have this backup of energy, light therapy energy, or the all the cofactors we talked about, increased cyclic AMP, increased ATP, and so on. When you have a backup of reserves there, your nervous system doesn't freak out at every little thing. And now they have a calmness because their nerves are not irritated, or it takes more to irritate their nerves in a life scenario than it did before light therapy. Okay, so I think that's a big deal. And let's see, we have an increase in ATP after red or near infrared LED LAD treatments in patients with chronic traumatic brain injury would have beneficial effects, including an increased respiration and oxygenation. Oxidative stress plays a role in the damage after traumatic brain injury. And so all very important things, and we could see the importance of using our LED products on patients with these conditions. Important thing that they talk about here are the acupuncture points that are associated with working on somebody with traumatic brain injury, and they specifically mention using red and near infrared LEDs, and this is primarily affecting the governing vessel. And this is an acupuncturist saying this. This isn't me. This is these points. They talk about, for example, in the effects of treating to help patients. Oops, one more. Help treat patients in a stroke in coma, for example, GV16, which is the connection where your occiput and stops, and you begin in that soft tissue right before C1, which is anterior. The acupuncture point is right by the brainstem there, by the cranial nerves. You have your inferior occipital protuberance there. You have your GV20, which is the vertex of the head, and GV24, which is near the center front hairline. And these points were treated in these patients that had the traumatic brain injury in the study. So they also mention the infrared and red LED may have irradiated the blood. And they talk about also doing direct in vitro blood radiation in surgery. And so if you're interested in that concept, you could read more about that in detail. Now, I'm not going to get into it again, but here they talk about the use of transcranial LED in the study to treat major depression. So that's I think I've seen a lot on depression. As I mentioned, we see an improvement in people's ability to handle stress when we strengthen their nerves using LED light therapy. So clinically speaking. Now, as a cost factor, I mentioned the cost factor. LED technology is not expensive, $1,400 to $4,000 to $5,000 range. The transcranial LED treatment protocol can be used at home. All right, degenerative central nervous system disease. Now this is the big deal. This is the stuff that's scary neurological stuff, and people really don't have an answer for these conditions or diseases. But we do with light therapy. We at least could help somebody transition through their life and strengthen their nervous system as much as possible using light therapy. It's a safe, non-invasive therapy that can be done at home for most cases and also clinically. So just to demonstrate, they're talking about familial amyotrophic lateral sclerosis, also known as ALS. And again, they associate mitochondrial dysfunction and oxidative stress to play the role in this, and that's beneficial therapeutic benefits when we're using light therapy. What they associate is improvement in motor function determined by certain tests that they do. And then we could also see them doing research with Parkinson's and the Parkinson's disease. And, there's a lot of research going on all these areas. So again, I don't want to get too into the details of this. I am going to mention a couple things. CNT is the control subject. So we start, what we're talking about. So important in the Parkinson's patients that they saw, that 2 hours, 2 hours after low-level light therapy, the average velocity of mitochondrial movement in Parkinson's disease, cybrid neurites, was significantly increased and restored to levels comparable with those of the control patients. That's a big deal. Okay, so we're seeing the mitochondrial function gets restored to a normal level. That's exciting. They talk about Alzheimer's disease, and they mention in this article that although no peer-reviewed publications have been published to these patients. Now, one of the most important sections in this whole document is here in spinal cord, and I'm going to just highlight these. Oops. Two sections here. All right, this is really important. Every single part of it is important, so I'm just going to read through it. Spinal cord injury is a severe central nervous system trauma with no effective restorative therapies. Now, they don't, apparently they're not documenting the light therapy that they're talking about, but also with the rehabilitative strategies of that are out there, including what I teach. But there are strategies to help restore the spinal cord injuries. Now, light therapy has biomodulatory effects on central and peripheral nervous tissue. For years, they thought that you could not affect change on these nerves. And then as certain doctors, Dr. Juanita Anders specifically was the pioneer in doing peripheral and central nerve rehabilitation or regeneration, which was absolutely amazing. And several groups investigated the effectiveness of low-level light therapy on spinal cord injury. This researcher demonstrated that low-level therapy applied simultaneously to the injured sciatic nerve and the corresponding segment of the spinal cord. So those that study neurological rehabilitation with me know that we always associate the nerve level of injury as part of the stimulation of the injury site. So understanding those patterns, we talk about those in the myotones, we also talk about those in the cranial nerves, but this is documenting that if they stimulate both the nerve root and the local location of injury, of the spinal cord injury, that the corresponding segment of the spinal cord accelerates and process of regeneration of the injured peripheral nerve. So it accelerates the process of regeneration. Regeneration. It regenerates nerve. And we're talking about after nerves have been, it's maybe not documented here, but in the research that I've seen, they talk about crushed nerve injuries. They've talked about different types of nerve injury that are regenerated. So this is the terminology that the researchers use. Now, I don't necessarily teach doctors to use that word, that verbiage, but it's important to know that this is what the research says, that the nerves are being regenerated. Okay, light therapy significantly increases the axonal number and distance of regrowth. The two spinal cord injury models, a contusion model and a dorsal hemisection model. In addition, low-level light therapy returned aspects of function to baseline levels and significantly suppressed immune cell activation and cytokine chemokine expression. So it did good for the good stuff and it suppressed the bad stuff, right? And these results suggest that light therapy promise for human spinal cord injury. It always surprises me when I read these light therapy researchers and they talk about the amazing results light therapy has, and then they're very conservative when they talk about their suggestion, and it suggests it may be promising, and instead of holy moly, this is the most amazing thing I've ever seen as what I teach, you know, when I teach the rehabilitation of the nerves. So in peripheral nerve, the next section here, they did post-operative rehabilitation, and they noticed it enhances the regenerative process of the peripheral nerve after reconnection of the nerve deficit, and it goes on to some details there. Okay, and let's also see here. Let's go to the end. Laser therapy can progressively improve neuromotor function, which leads to significant functional recovery. So we went over that conclusion. Real important points they make here is that low-level light therapy has no reported adverse effects. I'm going to repeat that. Low-level light therapy has no reported adverse effects, and no reports of adverse effects can be directly attributed to laser light therapy in these wavelength strengths of under 1,000 milliwatts. We believe that the high benefit to risk ratio of low-level light therapy should be better appreciated by medical professionals in the rehabilitation and physical medicine specialties. And their final thought, I think, was nice here as well. The particular benefits of low-level light therapy to both the central and peripheral nervous system suggests that much wider use of low-level light therapy could or should be made in cases of both brain disease and injuries. Well, there you have it, ladies and gentlemen. The article, I'm going all the way to the top here. Article titled Role of Low-Level Laser Therapy in Neurorehabilitation. I feel that it was a very good article for everybody to learn about. Please read it in detail, and if any specific is the detail of it. But again, highlight those sections that I talked about. Be able to talk about that with your patients, because a lot of people have questions about light therapy, and instead of sitting there and talking about all that research or trying to find all these different studies, here's one document that does a summary of all these studies that really saves your time and effort. And then God forbid you get in a legal situation, you know, you could use this document as a quick bringing people up to speed on light therapy, because when you're dealing in the legal environment, the lawyers don't know what you're talking about with light therapy. The people on the opposing side don't know anything about light therapy for neurorehabilitation usage. And so it's a very unique area of rehabilitation that we work in neurological rehabilitation. And the use of light therapy has been wonderful across the board. Light therapy is powerful. It's clinically viable. I've seen some tremendous results with light therapy. And if you haven't used light therapy before, you contact us for more information on light therapy and how to use it. But there's amazing light therapy products on the market. I don't endorse any products out there except for what we teach with. If you want more information on what we're doing with neurological rehabilitation, please check out quantumneurology.com, and you could get more information there. Now, this is the Hologram Podcast. My name is Dr. George Gonzalez. Thank you so much for being with me. And I'm glad I was able to go over this research. I hope that answered all your questions, and we'll see you next time.